This is the Bleeding Control and Shock Management Skills Evaluation. Your objective is to perform emergency interventions and bleeding control measures for a patient with emergency bleeding and shock. The equipment you will use today is a blanket, a tourniquet, an O2 tank, and a non-rebreather mask. In this scenario, your patient has arterial bleeding of the right lower extremity. Do you have any questions before we begin?
No.
Begin when you are ready.
Okay, so the first thing I'm going to do is take the appropriate body substance isolation precautions. Next, I'm going to apply direct pressure to the wound.
The wound is still bleeding.
Since the wound continues to bleed, I'm going to maintain direct pressure while obtaining a tourniquet. I'm going to apply the tourniquet 2 to 4 inches above the wound. Secure tightly. I'm going to tighten the windlass. Lock into place.
The bleeding has stopped, but now your patient is showing signs and symptoms of hypoperfusion.
Since my patient is showing signs of hypoperfusion, I'm going to initiate shock management. I'm going to start by placing my patient in the Trendelenburg position. I want to ensure that his lower extremities are at a higher elevation than his heart. Next, I'm going to administer the appropriate oxygen therapy. After that, I'm going to take heat conservation measures and cover my patient. Lastly, I'm going to call for immediate transport.
Congratulations, that concludes your bleeding control and shock management evaluation.